Hello viewers, thank you so much for joining me on this channel. If you have already passed MRCS Part A and you are from the ENT background, you basically have two choices. Choice A is you appear in MRCS OSCE and choice B is you appear in MRCS ENT OSCE. Of course, if you appear in MRCS OSCE, then you have to read up on general surgery. You'll have to go and watch a different video. But if you have chosen MRCS ENT OSCE and you want some help regarding how to prepare for MRCS ENT OSCE to become a member of the Royal College of Surgeons through the ENT route, then this video is just for you. Before I delve deeper into the content of this video, I want to share a story. When I appeared in MRCS Part A in September 2022, I did not expect to pass the exam, but I did in my very first attempt. So, it did occur to me after I passed MRCS Part A that now I had to appear in the second part, which I found out was MRCS ENT OSCE. I had no clue how to prepare for MRCS ENT OSCE. So what did I do? I went on YouTube. And I found a very nice video regarding how to prepare for MRCS ENT OSCE. And this is my attempt to help you prepare for MRCS ENT OSCE. So without further ado, let's get into the meat of the discussion. Now, the reason why I was very nervous before my MRCS ENT OSCE was I had no OSCE experience. This was the first OSCE pattern exam that I was about to take. I had appeared in multiple choice question format exams right from the end of school right till MD entrance exams, MS entrance exams. But I had not had any experience of the OSCE format. If you are from the DNB background, then you might have some experience regarding what OSCE is, and that will be an advantage for you. Also, the new regulation MBBS students will know a thing or two about OSCE. I did not know anything before the MRCS OSCE. Now, so in my mind, I had three challenges. This was an unfamiliar exam conducted in an unfamiliar format, and to top all of it, I would have to travel to an unfamiliar country because yes, MRCS ENT OSCE cannot be attempted from outside the UK. MRCS OSCE, yes, it can be. If you are from the general surgery background and you have passed MRCS Part A, you can take MRCS OSCE from India as well. But MRCS ENT OSCE, at least till the time of recording this video in January 2024, can only be attempted from within the UK. So three challenges: unfamiliar exam in an unfamiliar format in an unfamiliar country. Let's discuss the exam fees. So once you have passed MRCS Part A, you are eligible for MRCS ENT OSCE. The exam fees is 1047 British pounds. Again, this fees is for MRCS ENT OSCE, not for MRCS OSCE. And this fees is of data from January 2024. This figure can also change in the future. MRCS ENT OSCE is conducted thrice a year, once in February, once in May, and once in October. It consists of two parts. There is the non-manned exam and there is the manned exam. What is the meaning of non-manned exam? As the name suggests, in non-manned exam, you don't interact with any examiner. So there are no men. Slightly sexist term, but yes, non-manned exam in a very inclusive sense of the word, because there are female examiners as well. So non-manned simply means no human being apart from you at the station, and manned exam means there will be an examiner as well. Let's describe the non-manned exam. The non-manned exam is a computer-based online proctored exam. What does it mean? It means that it will be conducted on a computer. Again, this will be your computer. It will not be a computer provided to you. There will not be a center where you have to go. You can take the exam from the comfort of your own home, either in India or inside the UK or some other country. It doesn't matter. But what you need is you need a good computer. They will give you a list of technical specifications. that your computer should match. So it should be a good computer. It should have a fully functional webcam, because your activities during the exam will be monitored by a proctor who will basically be observing you through your webcam what you are doing. So there are certain activities which are prohibited, such as reading the questions loudly, because the person watching you through the webcam might think you are asking the answers. Somebody else is in the room and you're asking the answers. So you should not read the questions loudly. Your mouth should not move. And there are various other rules, like the room should be clean, there should not be any textbook or any mobile phone, and you should be the only one in the room. All these rules will be detailed before your exam, and you should definitely adhere to it, because they are very strict about it. And of course you require a reliable high-speed Wi-Fi. Mobile hotspots, even if you have the world's greatest mobile hotspot, that will not be acceptable. So they need a high-speed Wi-Fi, and as I said, a good computer with good technical specifications. In the non-mind exam, I highlighted these points because these points I felt were more difficult than the actual questions, because I know many people who are extremely talented who tripped up. They messed up by they failing to adhere to some or the other criteria. I know one person personally whose computer crashed during the exam. So there is no foolproof way to avoid this from happening, but if it does happen, then there is no choice. You have to appear in the exam again. The other thing that I want to highlight is the non-mind exam has 20 questions. So these questions are they are not very difficult questions, but there are certain things you should remember. You should not get these things wrong, such as if you have a CT scan picture showing guanal atresia, don't write guanal atresia, write bilateral guanal atresia, or write right-sided guanal atresia, or a better answer would be right-sided bony guanal atresia. You get my point. So if you have something like an audiogram, describe the audiogram, and you see there is profound sensorineural hearing loss in the right ear, and you write right-sided profound sensorineural hearing loss. Do you think you have answered that question correctly? No, you haven't, because you have not described the left ear. So be very careful about these things. If you are asked to describe an audiogram, even if the pathology is on one side, don't forget to describe the normal side as well. Okay, so these are little things, but the thing about non-mind exam is they have specific answers. So you have to answer accordingly, even though you are correct. Yes, if a person has right-sided profound SNHL, then the diagnosis is yes, right-sided profound SNHL. But their answer scheme might also include some things about the left ear, which may have been normal, which you also have to talk about. Otherwise, you lose marks. So these are some tips from my side that you should keep in mind. Believe me, these things may appear very straightforward now, but in the heat of the moment, you tend to forget these things, and you shouldn't. 20 questions, each are of 20 marks, and you have short answer questions. You have to type the answers. So you have to practice typing if you are not very confident about typing fast. So type the answers, practice typing, and you have to type the answers in the answer box that you will see on the screen. Some of the questions will have images. You can click on the images and they can become more enlarged and better to view. Okay, some questions will require more analysis than the others. Please manage the time accordingly, because the non-mind exam is of 2.5 hours duration, if I remember correctly. And although the question may appear to be really simple, really straightforward, but don't get into the situation where you don't have much time left, because the time is allotted with a lot of precision. So you don't really get time to think too much about an answer. So you have to be very, very careful about not getting into the situation where you have very little time and many questions left at the end. So if there is a question which is requiring a lot of analysis, my advice would be leave it for the end. So I had a question which required a lot of analysis. There were many pictures and we had to select one picture, or which pictures are fitting of certain scenario. It needed to be looked at multiple times. So I left that question for the end, and I had about 40 minutes just for that question at the end, and then I answered it to the best of my ability. So that is an advice from my side, which I think is important. Now the manned exam, it is held in person. While you can get away with, although get away with is slightly harsh, while you can attempt the non-manned exam from the comfort of your own home, even outside the UK, the manned exam needs to be attempted in person from either London or Edinburgh or Dublin or Glasgow. Now, the choice is not one out of these four. You can't choose to attempt the same exam. One person is attempting it from London, another one from Glasgow, another one from Dublin. No, that doesn't happen. So in a given situation, say in February of 2023, the exam was held in Dublin. In May 2023, exam was held in Glasgow. So you have to go to the place where the exam is being held in your session. The exam is held thrice a year, but there are four likely venues. It might be London, might be Edinburgh, might be Dublin, might be Glasgow. Again, doesn't matter which Royal College you're applying through. I had applied through Royal College of Surgeons of England, but my exam was in Glasgow. So please be very clear about this. Your exam center does not reflect the Royal College of Surgeons you are applying through. The exam is held by rotation by one of these four Royal College of Surgeons. So your exam, depending upon when you apply, might either be in London or in Edinburgh or in Dublin or in Glasgow. You have to go there. Please report much ahead of time because you don't want to get into a situation where you have appeared late, because that creates a lot of confusion. You might come across 4 stations and each station will have 30 marks, and each station consists of you, the examinee, an examiner who does not interfere with the exam process usually, and a simulated clinical scenario. So they might be an actor who may play the role of a patient. What would you be expected to do? You might be expected to take a history or break some bad news or take an informed consent for an operative procedure or explain a diagnosis. You might also be expected to perform a clinical examination either on the patient or on a mannequin. You will have, I think, 7 minutes for each task at each station, and of course you may get a station where it's a composite station. So maybe take history and then perform examination in the same station, or take consent for a procedure and then perform that procedure in the same station. So this can happen. For example, you might have to take history for a patient who is complaining of recurrent episodes of epistaxis and then perform anterior rhinoscopy on the patient. So, it can be a composite station. You will get time to read for a minute about what you are about to do, and then you have to perform the task in 7 minutes. You will not be allowed to look at the time, so you require a lot of practice, because you don't know if 5 minutes have elapsed or 4 minutes have elapsed. You will not get to check that while you are performing the task. So please practice as much as possible. How did I prepare for this exam? This time I took an online course provided by Dr. Osama Salim. So you can search about this online course on social media. You'll find it. It was very, very helpful. He made an unfamiliar exam in an unfamiliar format in an unfamiliar country extremely familiar, and I cannot recommend it enough. It was very, very, very good and strongly recommended. But again, full disclosure, I don't stand to gain financially if any viewer does subscribe to this course. I had also bought a book called MRCS ENT OSCE, which is very, very good. It provides a very good description of the clinical scenarios you can expect. And the most important thing, in my opinion, the most important thing is you need good, reliable, friendly practice partners. All of them are important. They have to be good, as in they should be preparing for the exam. They should be reliable, as in they should be able to practice at a regular interval. And they should be friendly, because you will be providing feedback to each other. And if the feedback is provided in a friendly manner, it always helps. You should also participate in as many mock tests as possible, whether it is manned exam mock test or non-manned exam mock test. Mock test will make it very, very easy for you. Some points that you have to remember. One is visa. So if you're applying from outside the UK, visa can be an issue. It was an issue for the session before mine, because they had to wait for many months to get the visa. This was not a problem for me because I got the visa in 15 days, but I don't know what your situation is going to be. So it is wise to get the visa process out of the way as soon as possible. Also, during the exam, you have to follow a certain dress code, which again the people at the Royal College of Surgeons will remind you of on the day of the exam. But just to be clear, you should not wear any jewelry on your fingers. Even wedding rings are not allowed. So you would have to, I have seen a person having to remove a wedding ring on the day of the exam sitting next to me, and his ring finger was in a very bad state after that. So you don't want physical pain leading up to the exam. You should arrive early because you don't want the hassle of arriving late and lots of confusion following that. And when you are performing a task, don't forget to sanitize your hands. Please speak slowly. Please be not just slowly, you should also empathize. You should express the right emotion when you are saying something. If you are saying, I'm sorry, you should actually sound sorry. Okay, it should not be memorized speech. And of course, time management is very important because you don't get to look at the time while you are performing the task. So these are some things I want to remind you of, and I hope this video helped you as much as the other video helped me. And all the best for your exam, and I hope you pass comfortably. Thank you so much for watching.